Yes, greetings to you. Hopefully you're doing very well. And my name is Robert Semwez Masaka, the Director, Home-Based Medical Services Television, that is HBMS TV, Talking Health, with very many other international organizations that we work with. And I want to bring it to your notice that every Friday at such an hour, we always have this late show. It is a healthy topical discussion on how we can live a healthier life. More importantly, I want to send greetings to the people who sponsor these programs, especially the Director, Mityana Institute of Nursing and Midwifery. Thank you very much for sponsoring these programs. But I also want to bring it to your notice that these programs are proudly sponsored by a product called VitaMax. VitaMax is a cardiovascular food supplement that me and you need. It's a natural product, but it is very important if you're a man out there and you want always to have joy. VitaMax is a very, very, very nice product that you need for your own health. So basically, today we are going to be discussing about ladies and gentlemen's joy. And our topic for today is that ladies and gentlemen can smile again. That is our topical discussion for today. And by the end of this session, if you follow through, you will see how you can live a healthier life, but more importantly, a happier life. So straight away, we will get into our topical discussion. Straight away, we will get into our topical discussion for today. And the topic is ladies and gentlemen can smile again. That is our focus for today in today's discussion. Once again, I want to send greetings to the Director, Mityana Institute of Nursing and Midwifery. But more importantly, allow me also introduce to you our star product, that is VitaMax, that sponsors these programs that we are on for today. So when we get into our topical discussion, there are things that you need to know. This program entirely runs every Tuesday evening. And for those of you who miss it because of different appointments, because of different things you're doing, you always have a repeat on Friday. And here we are. And in case you have any questions, you can always keep them coming and we will be answering them. So more importantly, this program is also powered by the Visionaries International. That is a very big team across Africa and across the globe that makes sure that you can live a healthier life. So statistically, I want to give you statistics. It all begins with a man. It's a man thing. You'll bear me witness that according to research, over 2.3 million men in the UK suffer from erectile dysfunction. And when you're a victim of this, there is no way you can be happy. And there is no way your wife can be happy. That is why our topic for today is about happiness and joy. So surprisingly, out of these statistics, they say 1 in 10 men in the world are thought to suffer from erectile dysfunction. We will be seeing what erectile dysfunction is, but more importantly, out of these very many people, 1 out of 10, only 33% of the men who suffer from erectile dysfunction seek help or advice about the problem. Very many people shy away. But more importantly, you also need to get these statistics. They're telling us that it is thought that erectile dysfunction causes the breakdown of 20% of all relationships worldwide. Nobody is willing to stay with you when you cannot perform your duties as a man. Then out of that, they're telling us that male infertility accounts for over 40 to 50% of all infertile issues. Gone are the days when a family didn't have a child, all the blame would go to ladies. But this time around, statistics show that it is now coming to almost 50-50. But more importantly, I want to share with you what is erectile dysfunction or impotence. And in simple terms, this is the inability to get and keep an erection firm enough for sex, or at times long enough for sex. That is to do with erectile dysfunction, and it is very common in men. And among the causes, we can talk about diabetes, we can talk about heart diseases that are not known, we can talk about hypertension, we can talk about stress, we can talk about over the age of 40 and above. But more importantly, you can subdivide these issues or causes into different angles. For example, we can talk about poor blood flow, and it is very common in diabetes, high blood pressure, and then smoking. Then the other one is nerve damage. You look at, again, diabetes and surgeries. Then the other one is psychological and emotional issues like stress, depression, and very many other things. Then the other one, you can talk about drugs, the use of drugs, be it alcohol, be it medication, anything can become an issue. And then as a man, you cannot perform and you can never have that joy. Then the other thing that I want to talk about is hormonal issues like the testosterone, that is to the men. But more importantly, anything that would affect this body part, be it the bladder, be it the pubic bone, the seminal vesicles, the prostate gland, the urethra, erectile material, all this, anything that can happen around here can take away your joy as a man. So you need to take care of your body, you need to take care of your important part on you. And more importantly, in relation to today's topic, I want to tell you that joy begins with ladies. As long as ladies are not happy, it simply means there is something wrong. But one of the major things you is following us today that affects ladies and takes away their joy is infertility. But your question would be, what's infertility? I want to bring it to your notes, you is watching us at HBMS TV Talking Health. Infertility means not being able to get pregnant after at least 1 year of trying. You want to get pregnant, but you're failing. Or 6 months if the woman is over the age of 35. Remember, the levels of infertility grow with age. But the other thing that you also need to notice, you is following us, if a woman keeps having miscarriages, it is also called infertility. Very many people get miscarriages for different reasons, for different causes. As we will be seeing, as we will be discussing more and more, you is following us. But more importantly, I want us to look at the causes of infertility in women. These causes are usually silent and undetected in women. And at times they can include, number one, is age. As you grow in age, you're increasing your chances of not getting pregnant. Then the other one is lifestyle. The life that we lead. Very many people are turning to shishas, alcohol, sedentary life, and all that. In one or the other, it is affecting us. No wonder these days the rate of infertility is too high. Then the other one is environmental factors. But more importantly, I can talk about lead poisoning and other toxins in the body, or generation of free radicals. Then talk about diseases like chronic urinary tract infections. They can also affect the reproductive system, and then you can become infertile as a lady. Then we have physical problems. Let me say one person is involved in an accident, and then the reproductive system is affected in one or the other, but you can also talk about too much physical work. Then talk about hormonal imbalances, for example, the estrogen, talk about the progesterone, talk about prolactin. I want to bring you to your notes that you is following us on this show, that high levels of prolactin in blood can stop the ovaries from making the hormone estrogen, and low levels of estrogen causes irregular periods, and at times even it stops the periods completely. It even reduces the sexual drive or the libido, and more importantly, it can even cause the vaginal dryness. All these factors combined together, they can result into infertility. But I want us to look at the major causes of infertility. Number one is hormonal imbalances. And when we talk about hormonal imbalances, we talk about hormones like estrogen, we talk about hormones like progesterone, we talk about like prolactin. These hormones have to be balanced in your body. Naturally, God created women when these hormones can balance naturally. But because of different reasons and factors that I've shared with you, these hormones can come out not to balance, and at the end of the day, you will not be in position to get pregnant. Then the other factor is the ovarian cysts. Here you look at the normal ovary and then the ovarian cyst. This combines, you can talk about the whole uterus, you talk about the vagina, in one or the other, as long as you have the ovarian cyst, they can affect you. Then the other one is the endometriosis, inflammation of the endometrium. The moment it happens, whether inside, whether externally, anywhere around that important body part, the reproductive system of the women, you can have issues of infertility. Then we can talk about fibroids. I want to bring you to your notice that these days, there are very, very many cases of fibroids, and very many people go unnoticed, not until they fail to get pregnant. That is when they look at it. But fibroids can get to any body part of the reproductive system or the uterus or the fallopian tubes, anywhere. You can have a fibroid, you can have a cyst, and they can be of different volumes, and they affect you in one way or the other. Another thing that would bring about infertility in women is tubal blockage, more importantly, the fallopian tubes. The moment they're blocked, somebody is at risk of not conceiving. And more importantly, I also want to bring it to your notice. If I have men who are following us at HBMS TV, it is now 50-50. We all contribute. Men also have contributing factors on the issues of infertility. We can stop this habit of all the time blaming women every time a family fails to get a child. I want to tell you that if you have issues of low sperm count because of different reasons, infertility issues will come in. Then talk about abnormal sperm production or function due to undescended testicles. Then you can talk about genetic defects or health problems such as diabetes. Then you can talk about infections such as chlamydia. Talk about gonorrhea. Gonorrhea is the hero's disease in an African setting. But you can also talk about mumps, which is a viral disease, but also the infection of HIV can also contribute to this factor. Then the other one is enlarged veins in the testes. It is called varicocele. Also, this can affect the quality of sperms or no release of sperms at all. Not forgetting stress, then anxiety of making someone pregnant or fear of responsibility. When you combine these factors all together, somebody is going to fail to get pregnant and issues of infertility are going to come in. Allow me to talk about the causes of infertility in men. This one is let's talk about the sperm abnormalities. Sperm abnormalities can be as a result of, number one, sexually transmitted diseases. You can talk about diabetes. You can talk about varicocele, then talk about obesity, then you can talk about hormonal imbalances, then the other one is toxins or even heat exposure that even kills the sperms. That is why when you look at long distance drivers, those truck drivers, every time they're sitting on an engine, they can fail to make somebody pregnant. Then you can even talk about trauma. All these are things that affect us, but I also want to talk about the risk factors, probable causes of infertility. I want to talk about stress. You can talk about obesity, talk about excessive use of caffeine. You can also talk about excessive use of alcohol, abusing alcohol use. Then talk about smoking. Then the other one is extreme exercises. And you who is following us, I can't live without talking about the environmental factors that negatively affect our health and cause free radical damage. We can talk about processed food, chips, chaps, the burgers, talk about medicinal side effects, talk about air pollution, talk about water pollution, unhealthy lifestyles, stress, even the medicines that we use. And these are some of the signs and symptoms of infertility. I'll look at the ladies first because it is ladies first there. Number one is failure to conceive. When you fail to conceive for a long period of time, that is a sign of infertility. Then we can talk about irregular periods. The average woman's cycle is 28 days long. At times, we have had ladies who go to 35 days, 21 days. Anything without that average is abnormal, and it is a sign, or it could be a symptom. Then the other one is painful or heavy periods. Most women experience cramps with their periods. It is also an issue that can be a sign of that. Then no periods at all. I want to bring it to your notice if you're a lady. that it is not uncommon for a woman to have an off man here and there. For example, somebody can have unprotected sex and just that stress to fear of getting pregnant, somebody may miss their periods, but it does not mean that they're infertile. Then symptoms of hormonal fluctuation, talk about pain during sex. Then the other hand, I want to talk about men, problems with sexual function. For example, difficult with ejaculation, or small volumes of fluid ejaculated, or reduced sexual desire or drive, or even difficulty in maintaining an erection, which results into erectile dysfunction. Then the other one is pain, or swelling, or lump in the testicle area, or the other one is recurrent respiratory infections. Talk about low blood pressure and very many other things that affect us in one way or the other. Talk about diabetes. It is also very common. Then I want to tell you that when you look at the medical management, infertility treatment depends on the following factors. What is causing the infertility? So that can be put in place to address it. Then the other one, how long you have been infertile. Then the other one is your age and your partner's age. You can find somebody is too old to make somebody pregnant. Then talk about personal preferences. But I want to bring you to your notice that some of the infertility, some causes of infertility cannot be corrected. But my major focus, I want you to look at the different modes that we have. We have laparoscopy for blocked tubes. That one can, the doctors go an extra mile, the surgeons, to go inside, they create an incision, which is very painful at times, but they help you out on blocked fallopian tubes, but it can also work for, that is laparoscopy. At times they have to do total removal of the uterus and all that. But also we have surgery, of which I would say you need to seek medical attention here and there before you can go in for surgery, not anyhow. You need to get it from professionals. But more importantly, how can you reverse infertility and get pregnant naturally? What I'm going to share with you today on this show is not the gospel truth, is not the final thing, but I want to tell you, and it is not purposely formulated to replace the medical advice, but you can do it for your own health. Some of the things that we need to do about the natural management plus food supplements, which are very vital, taking antioxidant supplements, or eating antioxidant-rich foods, we hope improve fertility rates. You who is out there. Then the other one is eating more calories at breakfast and fewer at your evening meals will also improve your fertility rate. Then the other one, avoid foods high in trans fats. Then you need to avoid refined carbohydrates, as these raise the insulin levels, which may increase the risk of infertility and make it harder for you to get pregnant as a woman. Then the other one, eating more proteins from vegetable source instead of animal sources. Then you need to focus on taking multivitamins that are approved. This one will also help you boost your fertility rate. Then avoid sedentary lifestyle. This is very important. Sedentary lifestyle is not good at all. Then the other one is managing your stress levels. When you manage your stress levels, this can help you increase your chances of becoming pregnant. More importantly, being either underweight or overweight reduces your chances of becoming pregnant. So you need also to look at that. But more importantly, I want to bring you to your notice that more antioxidants will give you high chances of getting pregnant. And it is at this point that I want to talk about the key against free radicals. Strong immune system. This can only be attained by taking more antioxidants to neutralize the free radicals and have the balance in your body, and hormones can keep at their levels, and that will help you get pregnant. And what are antioxidants? Who is following us out there? I know very many people are following us from different countries, from different continents, but you want to know what an antioxidant is. These are specific nutrients in our food that prevent or slow the oxidative damage to our cells. And they act as radical scavengers, free radical scavengers. They prevent and repair free radical damage. And I want to bring to your notes that phytonutrients act as antioxidants to help the body's defense against free radical damage. And how do you get them? By taking what we call natural fruits and vegetables. Actually, the World Health Organization recommends that an average person would averagely take over 5 to 9 servings of fruits on a daily basis. and 5 to 9 servings of vegetables on a daily basis. But you'll bear me witness that we can't afford that. So how do we get the antioxidants? By having a mega dose of antioxidants, by taking highly quality nutritional supplements that optimize natural defense against diseases. They boost your immune system. They provide you with the nutrients and vitamins and minerals at optimal levels. And at this point, I want to introduce to you the next generation nutritional food supplements from Nature's Way. I want to talk about this product here. One of our star products. I call it a star product or a king product. It is called C24/7. C24/7 simply means complete nutrition, 24 hours, 7 days a week. More importantly, it's nutraceutical, not a pharmaceutical, manufactured by Nature's Way. And when you look at it, what does it do? It does what we call cellular protection, cellular immunity, cellular energizer, cellular enhancement, cellular support, cellular nourishment, cardio protection, and cancer protection. And C24/7 here that you see has over 22,000 phytonutrients or plant nutrients. It's a breakthrough product. It has over 29 vitamins, minerals, and trace minerals that you need in your body to keep your body healthy and be in position even to reverse infertility or prevent it. But more importantly, it has also over 12 whole fruit juice blend. When they get a fruit, it is blended whole. Talk about these berries, the different types, apricot, talk about the pawpaw, talk about the oranges, talk about grapes, the pineapple, the cherry. It is blended whole and put into this capsule, and it is natural. Then the other one, it has over 12 whole fruity, whole vegetable juice blended, the parsley, the carrots, the spinach, wheatgrass, Brussels, asparagus, all these things, Blockage, they are blended and put into C24/7. That is why it is very vital. Even talk about the cabbages, talk about the garlic. It is even has been over 18 amino acids. C24/7 that you see here has over 14 super green foods or spirulina brain. When you look at these things, they have a role they play in your health. They have a role they play in your fertility levels. And more importantly, it has even 12 different mushrooms from Japan. If you've seen Japanese, these are people who look younger, they live longer, and they're very strong. This is what they use. More importantly, it has 12 digestive enzymes, 12 special nutrients, 10 essential fatty acids, but more importantly, it even has the anti-aging and antioxidant enhancers. This is for the ladies. This product is very good in preventing all complications that come with age. All these things are into C24/7. So what they do, they use the nanotechnology to blend very many components, just like you see them here, over 140 components, and they are put into one capsule, C24/7, just like that. And when you look at this capsule here, C24/7, it does not have the 30 to 40 excipients that are added to other drugs, other pharmaceuticals. This one does not have the gamma ray, the fillers, and the binders. It is 100% natural. So when you look at this product, there is even a study that was done to look at its level of disintegration once you put it into your body. And when you look at this product, just in 15 minutes, when you put it into your body, it has disintegrated during the study compared to other brands. So I want to bring it to your notice. If you're a man and you're out there and you want to have joy, you want to be excited, you want to be happy, Vidamax is the cardiovascular food supplement that is going to give you a healthier heart. It is going to give you a healthier blood circulation, a healthier body, and it works on your sexual vitality 100%. It is not addictive at all. But more importantly, you can also consider the 40 days complete detoxification and total cleansing of the body. That is, if you have issues with infertility, you have issues with the sexual vitality, you have issues with infertility, this detoxification can help you very well. These products are not formulated to replace any medical advice or medical treatment. It is just a supplement. But more importantly, you can also look at restoring your ability to get pregnant and be able to carry your child to term using natural proven products. That is, if you're a lady and you're out there and you're 40 years and above, this is for you. And it's going to help you on having your hope for ladies to smile again. It is going to help you to smile again and have the joy. I want to thank you very much for following us at HBMS TV, Talking Health. And anyone who wants to know more about this, you just need to tune in to our channel. That is HBMS TV, Talking Health, and you're going to be in position to learn more and more about your health and how you can live a healthier life. Thank you very much for following through, and may God bless you.